What is intravesical gene therapy for bladder health? Imagine a treatment that delivers healing instructions directly to the inside of your bladder. That's what intravesical gene therapy aims to do. It is a medical approach designed mainly for bladder conditions like non-muscle invasive bladder cancer, which is a type of cancer that stays within the inner layers of the bladder wall. This therapy involves inserting a tiny tube called a catheter into the bladder to deliver genetic material straight to the affected area. The goal is to target cancer cells or boost the immune system's ability to fight the disease right where it's needed most. One of the most well-known examples of this type of therapy is a treatment called nadofaragene firadenovec, which is approved by the Food and Drug Administration. This treatment uses a harmless virus that has been modified so it cannot replicate. The virus acts as a delivery vehicle, carrying a gene that instructs the bladder cells to produce a protein called interferon alpha-2b. This protein naturally helps the body fight cancer by activating immune responses and directly attacking tumor cells. When the virus delivers this gene into the bladder lining, the cells start making interferon alpha-2b locally, which can help shrink tumors and prevent their return. This therapy is especially important for patients with high-risk non-muscle invasive bladder cancer who do not respond well to standard treatments like Bacillus calmette-guerin or BCG. BCG is a common intravesical therapy that stimulates the immune system to attack cancer cells. However, some patients do not respond or cannot tolerate BCG, and for these individuals, intravesical gene therapy offers a promising alternative. It is less invasive than surgery and has shown to be relatively safe, with side effects usually being mild. Common issues include bladder spasms or a feeling of urgency to urinate, but these tend to resolve quickly. Clinical studies have shown encouraging results. About half of the patients treated with intravesical gene therapy experience no detectable cancer within 3 months. Even more promising, nearly half of those patients maintain this response for at least a year. Because it is a targeted approach, it minimizes damage to healthy tissue and helps preserve bladder function. It also provides a new option for those who want to avoid or delay more invasive procedures like bladder removal. In summary, intravesical gene therapy is an innovative way to treat bladder cancer by delivering therapeutic genes directly into the bladder. It stimulates the body's immune system and fights cancer cells locally, offering hope for patients with limited options. As with any medical treatment, it's important for patients to discuss with their healthcare providers whether this approach is suitable for their specific situation. This therapy represents a significant step forward in managing bladder cancer, with a focus on safety, effectiveness, and quality of life.